On today's Two on Your Side Town Hall, your family may be planning for back to school, and so are districts in light of the pandemic. What the state said today that might come as a surprise.
Plus the uptick in COVID cases among children ahead of the fall, what we're seeing around the country compared to right here in the Buffalo area.
And later, we'll be celebrating Western New York and talking live with the president of one of the best summer festivals in the region.
I see some corn. It's good stuff.
In our future.
Yes, absolutely. Thanks for being with
We're
us,
all
everybody. We start today's show, though, with news about COVID and kids, and specifically those plans to reopen schools in just about a month's time.
And there are a lot of questions among parents and teachers and staff and superintendents, and there is guidance from the federal government, but not from New York State. So today we got this statement from Dr. Howard Zucker, the state health commissioner, saying that since the state disaster emergency expired in late June, quote, school districts are reestablished as the controlling entity for schools.
He further said that schools and school districts should develop plans to open in person in the fall as safely as possible. And he said he recommends following guidance from the CDC and local health departments.
Our Kelly Dudzik has a full report with reaction from school leaders in just a few.
First, though, we welcome to the show Dr. Thomas Russo, Chief of Infectious Diseases at UB's Medical School. Dr. Russo, thanks for your time.
Glad to be with you guys.
It's always great to see you. So what should school districts do this school year, and how do they make that decision, and who should they be listening to right now without guidance from the state?
Well, at this point, it appears that school districts are going to be able to decide for themselves, and that may change, but I really think that's a nice option because the key point here is the level of community disease. And we'll see where we're at when school starts. But I think it is clear that if there's a substantial or high degree of disease in the community, since many of our children in K through 12, of course, less than 12 are not eligible, and many that are older are yet to be vaccinated, they're at risk for getting infected and without, some potential consequences. So mask uses may be the order of the day. That will also allow students to get closer together, the 3 feet, so we could get everyone back to school. I think would be great if we could get people back to school, and masks may be a critical bridge to go ahead and be able to enable that where we're trying to get people vaccinated.
Dr. Russo, we've seen headlines around the country about a pretty big increase of children testing positive for COVID-19. I want to show this, a national report showing nearly 72,000 new pediatric cases reported last week. Compare that to roughly 39,000 new cases the previous week. It's an 84% jump. And as of late July, about 4.2 million children total have tested positive for COVID. Children and teenagers now representing about 19% of all the reported cases. Experts do, though, point out that the number of hospitalizations is still pretty low. We checked in with Children's Hospital here in Buffalo today. Currently only one COVID patient there. So how do you process all of that, and what should parents know as they're watching this very closely?
Well, I think these cases speak to exactly how infectious this Delta variant is. It's if you're unvaccinated and put yourself in at-risk situations, it's going to find you. We're quite fortunate that in this pandemic, children have fortunately done fairly well when infected, but we do know that occasionally there are bad outcomes. And so while children are waiting to either become eligible or in their process of getting vaccinated, I think it's critical that parents and children make every effort to protect themselves, follow public health measures, and minimize the chances that they'll get infected. And it's also important to realize that fortunately children do fairly well with this, albeit with uncertain long-term consequences, but they also do have the potential to transmit and spread the disease to older individuals that may be more vulnerable. So yet another reason to protect our children.
And Erie County has said that it is watching the hospitalization numbers to determine if mask requirements need to be back in place for all public indoor spaces in the county. Right now, businesses get to decide whether or not to require masks, but the county has not said what that number is, what's too high for hospitalization. So we're going to show viewers right now the current hospitalization chart for our region. 70 total for Western New York. It's trending up, but of course it's way below the previous peak. So Dr. Russo, What is the threshold, in your opinion, the point at which hospitals start to get overwhelmed? And with the 65% of the eligible population in the county already vaccinated, might we avoid that?
Well, I think we are going to avoid our hospitals getting overwhelmed. Fortunately, we've done pretty well with vaccinating here in Western New York, and particularly with our more elderly population and the most vulnerable. But I think it's also critical to point out that you need both shots of the RNA vaccines to protect against the Delta variant. And we still have here in Erie County 22% of people over 75 that have yet to be fully vaccinated. So although we're doing well, hospital numbers are manageable, we're still in the middle of this surge. We're not done yet. And albeit we've done a pretty good job, there's still work to be done. So in particular, if you're older, if you're vulnerable with underlying diseases, and most people in general, I think it's prudent to protect yourself. And one of the key measures you could do is wear a mask while you're waiting to get vaccinated.
Finally, Dr. Russo, we're almost out of time, but where are we in this latest surge? We know that it's a lot worse in other parts of the country, and we also know in some places overseas that, this Delta variant kind of hit hard and then it subsided. So what do you think we're going to expect here in the coming weeks and months?
Based on data from India and the UK, the Delta variant surge, the upward curve lasted 7 weeks, and the downward curve was about 5 weeks or so. We're hoping we'll see the same thing here in the United States. That remains to be seen. Here in Western New York, we're a little bit behind. The surge began in the southern states. We're about 3 weeks plus into the increase in cases and hospitalization here. So I think that we're still going to see an increasing number of cases and hospitalizations, unfortunately, over this month of August. And that's why, to really minimize the damage from this variant, if people could really gather themselves, use good judgment and mask use when appropriate, and so that we could get out of this with the fewest number of bad outcomes.
Dr. Thomas Russo, infectious disease expert with UB, joining us as he's seeing patients at the VA hospital today as well. Doctor, of course, as always, thanks for your time.
My pleasure.
All right, let's talk more now about the back to school debate. As we mentioned, the state health department today confirming that it will not be issuing guidance on reopening, that's going to be left up to each district to decide.
At Two on Your Sides, Kelly Dudzik spoke with two superintendents as they figure out their policies for the fall.
The New York State Department of Health said Thursday that school districts should develop plans to open in person in the fall as safely as possible, with the recommendation of following CDC and local health department guidance.
I've been advocating for a long time that local municipalities and local school districts should have the autonomy to make these decisions 18 months into this pandemic.
Niagara Falls City School District Superintendent Mark Laurie is ready to propose to the school board that for this year, students wear masks on buses and in hallways and are strongly encouraged to wear them in the classroom, but ultimately that choice will be left up to families.
With that guidance, we'll monitor the science. We'll stay in contact with the Niagara County Health Department. We'll watch any trends in the school district, and we'll adjust if we have to.
And he says that could mean stronger mask rules. In both Niagara Falls and Hamburg, students will be going back to school 5 days a week for in-person learning.
I think generally what you can expect is an opening of school that looks substantially like it did in 2019.
Michael Cornell is the Hamburg Central School District Superintendent and the president of the Erie Niagara School Superintendents Association. Cornell asked the state for guidance for the 2021-22 school year in May, requesting it by June, and it never came.
We're going to have 3 feet of physical distance with discretion beyond that. We're going to have full school buses, and we're going to do everything we can to make sure that we do all of those things in the safest possible way, because we want our schools to be safe for learning and work.
He says by collaborating with the county health department, most districts will wait to see what's happening with the infection rate closer to the start of the school year before setting certain policies.
So you should be getting calls or emails or both from your school district about all of this. A lot of them are also using social media, and in Niagara Falls, they're doing special open houses this year before school starts to go over everything and answer any questions that families might have. Yeah, and certainly right now you have to imagine a lot of people are just enjoying their summer still. They might not be thinking about going back to school just yet, but there's going to be just an influx of questions coming up.
Right, and teachers and staff members will be there to answer them for everybody.
All right, Kelly Dudzik reporting live. Kelly, thank you.